Hi everyone, welcome back to the clinic. Today we have Dr. Ranganath Vedala to answer 20 questions about being a radiologist. Hi there, Dr. Vedala. So could you give us a bit of an intro about yourself? Oh, hi there. Could you give a bit of an intro?
Which one?
An intro. So what is your job title?
I'm a radiologist.
Oh, so, okay, go ahead.
And also I worked as a chief of radiology for about 20 years. 20.
How did you become interested in this work?
I took this field because it is a coming up specialty. I thought I may have better opportunities to go higher in my position, higher in the. It is a new field. I thought I could avail that opportunity.
What type of education did you need for this job?
Basic education first is medicine. In India, it is called MBBS. I had MBBS. Then later on, I went for specialization, that is the radiology. The degree is MD, Doctor of Medicine in Radiology. I did it in All India Institute of Medical Sciences, New Delhi, between 1965 to 68.
So what prior experience did you need for the job?
The experience for the job, after this getting MD degree, then I worked in Guntur Medical College in India for about 4 years as an assistant professor of radiology. Then I left India in 73 and came to, I always wanted to pursue a little higher, to get more experience and get more degrees. That is what because I passed ECFMG to qualify to come to India, to come to USA, to learn more and get some experience. That is in my field of radiology. That is how I thought of coming over to United States of America.
So with technology demands increasing and changing, how
Yes.
does this affect your job? Or how does it affect your field per se?
How does it? What is? How does it?
How does it affect your field?
Yeah, by coming over here to United States, I got exposed to this radiology in India at that time. Is actually radiology is only just X-rays and X-ray treatment. But as soon as I came here, a lot of developments have happened in radiology. As you know, the computerized tomography, which has revolutionized the diagnosis in medicine. So that has taken place in 1973 onwards. Actually, the CT scanner first came to first London. The the person who made this field is Hounsfield. He is actually an engineer working in on ultrasound Navy with the help of the Beatles. Those people gave money to him, and then he's a ultrasound specialist, and then he started this computerized tomography. He is the one, along with another physicist also. So both of them got a Nobel Prize in 1975. That is the time the radiology took over, major, unless anything for a surgeon to operate without a diagnosis. Previously, they used to, the pain abdomen means, it could be appendicitis, it could be gallbladder. But as soon as you do a CT scan, you can rule out, it will specifically tell what the patient is suffering from. So the diagnostic level has increased 100%. So it has become a great tool in the hands of a physician. And a surgeon never operates without seeing a report on the CT scan. There is no speculation nowadays. It is 100% accuracy. That is how it goes. So it has opened up the specialty took over, and then a lot of importance has given to radiology nowadays. In each and every field of medicine, without a computer as a tomography or an MRI, nobody will operate or anything, So so the technology has immensely expanded so much that radiology became a more super special. Everybody is after radiology because it has such a great, tremendous importance in medicine, in the field of medicine.
Interesting. So going along the lines of that, where do you see radiology in the next 5 to 10 years with AI, machine learning, all of that?
Yes, yeah. More and more, radiology should be opening doors to some of the, why people are, there are a lot of problems, that is playing, about the brain, actually, dementia, why dementia people are getting like that, or multiple sclerosis. There are several inherited diseases, and which you cannot explain. So they are more and more applying various ways of getting to the bottom of the diagnosis of some of the so-called hereditary diseases or unknown or blood diseases, that are transmitted. So they are going, I think, in 5 to 10 years, they are definitely more and more diagnostic tests, MRI will be more useful in each and every aspect of the medical diagnosis.
So what
there are
would
a
you
lot of
okay.
future in the way of MRI, functional MRI. That is what everybody is going after. And I think artificial intelligence is also going hand in hand, and that is giving more weight to this field.
Okay, so what would you say you like best about your job?
What is the question?
Oh, what is your favorite part of your job or radiology?
Favorite part is, gives so much satisfaction that, you have pointed out something that is abnormal in this, that is the cause for his symptoms. So you will be gratified to locate, we have successfully gave a diagnosis that is the root cause of this problem. That is how a satisfaction is there for what you have done, in any branch, like in diagnosing a cancer in a breast or in the abdomen or in any of the organs in the body. And if you can pinpoint There is nothing like that. That is the most gratifying thing that you can tell.
What do you dislike about your job? One thing you don't like about radiology?
Uh, One thing, human contact with the patient. That because you are looking at the images, but human touch and other things, getting emotional or the dealing with the patient day to day, how he is, that you don't, as a radiologist, you are not, you are permitted to the to your own view station or something. But nowadays they are also improving. They are, you see, unfortunately, the due recognition, the patient doesn't know how the diagnosis has come. So it is the person who is dealing, the surgeon or physician, should explain the radiologist made this diagnosis. Unfortunately, so that type of thing should be is not coming. Real recognition hasn't come. That is the thing. But you see, the same thing, radiology. There are radiology is also, it is multi-speciality people. Those there are people who only read mammograms, only the breast disease, only they are confined. There are some people who does musculoskeletal radiology, that is involving bones and muscles. So there are people who does everything. In my when I because I started as a general radiologist, and then build up my as the procedure, as the field is expanding, I learned and then became proficient in the other fields also. So I have knowledge from basic radiology to MRI, CT scan, ultrasound, nuclear medicine, like that. But those because in radiology also is so much compartment, because specialty is growing. That's why people don't read each and everything, because you will not proficient. Suppose a general radiologist cannot have the same depth as a person who day in and day out reading only MRI scans from top to from morning till evening. But on the other hand, if you know the basics also, that will also improve, uh, instead of looking at only MRI. But if I know even the other field also, like a simple X-ray, how to read, that also, if you can correlate, that will be great.
So, as you said, radiology is such a broad field.
Yes.
What would you say is your favorite subject or specific part of radiology?
I MRI of the MRI scan of the brain. I like it very much. So overall MRI scan, CT, and those two things, MRI and CT, I liked in the field of radiology. I'm not very much in the interventional part. The interventional radiology is another big field where you get again, they perform procedures just like a surgeon, but without opening or anything. Procedures are there, and they also get to the bottom of the diagnosis.
Mhm. So, if you weren't in radiology at all, what other profession would you want to go into? It doesn't have to be medical.
Oh, what other field I would have liked it if I am not a doctor?
Not just not doc like radiology. Like no radiology. What else would you be? Would you like?
I am more into medicine, general medicine, internal medicine. That's all. Medicine. I'm not good in surgery or anything. I didn't have that much. It requires some skills to do surgery, but I like general medicine.
General medicine. So, why should someone choose radiology?
Why somebody should read? As I said, it gives, it is a different, as I said, one should, uh, uh, the, an interest to look at the images and then give a diagnosis. There is not much, what I mean to say, it is not a patient contact or anything, but you are alone on you have a particular area that one should have an interest first to have a I am able to, I like the field of diagnosis. I can solve the problem why the patient is having pain, so I can pinpoint it, whether it is there or not, yes or no. That is what, that is the satisfaction that you get being a radiologist.
So, last question. What is one piece of advice you would give to someone looking into getting into your field?
What I advise is you should also have some grasp of basic medicine also. Instead of confining to radiology, you should at least know the basic medicine, like, examining a patient. These things, they will also tell, when you are getting into medicine, and when you are going into residency. I don't know in this country whether they go around, when you are getting into the clinical type, how to examine a patient, and what are supposed to, you have to look up for some signs. Suppose if it is a gallbladder, where exactly the patient is having pain. Okay, is it a referred pain, or is it, what type of? So one should have a grasp of some clinical information also. Okay, that also one should have before going into radiology.
All right. Well, thank you so much, Dr. Vedala. And we hope to have you back on the show sometime soon. Thank you.
Okay, you're welcome. You're welcome, Rishi. All the best to you. Good luck.
Thank you. Thank you.
Okay.
Bye.
Bye.